All right, it is 11 o'clock and we're going to go ahead and get started. Good morning and welcome to July's Emergency Preparedness and Response Lunch and Learn. Today's presenter is Jonathan Falk. Jonathan is the Epidemiology Program Manager in the Office of Epidemiology. He'll be presenting on Public Health Emergency Preparedness, or PHEP, Capability 13, Public Health Surveillance and Epidemiological Investigation. Over to you, Jonathan.
Thank you, Donald. All right. Good morning, everyone. I'm glad to be here, joining you all for lunch and talking about surveillance investigation from the lens of the PHEP Capability 13. I've been with VDH for 16 years, 9 of those as a district epidemiologist, and the last 7 in my role as an epi program manager, sort of overseeing loosely what I think we would call emergency preparedness epidemiology work within the Division of Surveillance Investigation, definitely through the lens more of surveillance. So today, I wanted to briefly provide some background. I know that there have been a few lunch and learns on different capabilities already, but just to kind of reiterate that I am pulling most of the information for Capability 13 in our discussion today from the Public Health Emergency Preparedness and Response Capabilities, the national standards for state, local, territorial, and tribal public health. I have that link there as a reference. I believe these slides will be shared or available, but that hyperlink does exist. There are 15 capabilities that are listed in this document, and in general, the goal is to, from a national perspective here, kind of strengthen the security and resiliency of the Commonwealth of Virginia through preparation for any kind of emergency or emerging threat, and do it in a way where these standards kind of apply nationally across all the different states. So we're kind of in lockstep at the national and at the state level with everyone else. Additionally, in different emergency responses, we do play a role within what is called an emergency support function, number 8, health and medical specifically. And that's something that we collaborate with or coordinate with the Virginia Department of Emergency Management. And so these capabilities were also designed to kind of align with those sorts of support functions. So ultimately, as we move through these, the goal is to continue to assess, look at what is the national standard, how that's being applied. For the presentation today, the language, I think, does speak a lot to the state level, but even so, I think a lot of the emergency planning that we do at the local health district level, these do apply there as well. Those capabilities in that national document are divided into 6 domains and 2 tiers. So today's Capability 13, the Public Health Surveillance and Epidemiologic Investigation, is contained within the biosurveillance domain. There is a second capability that speaks primarily to laboratory testing. Both of those are tier 1, which ultimately means it's sort of like a key foundational capability to public health emergency preparedness. Within these capabilities, the document does further go into functions, and then within each function kind of describe a task. And so those functions are segments of that capability that must occur in order to say that we've achieved that capability. And then tasks are those action steps that need to be accomplished in order to say that we've completed or achieved that capability function. So with that, I'm going to go ahead and dissect a little bit the Capability 13. The definition as a whole ultimately states that we are trying to create, maintain, support, and strengthen routine surveillance and detection systems and epidemiologic investigation processes. So really looking at the overall work that we do at the state level and at the district level day to day, conducting our disease surveillance and conducting our epi investigations, field epi work, et cetera. And then there is a second component there too that ultimately says that we have the ability to expand or scale these systems and processes in response to events of public health significance. And so I typically think of this in terms of things like COVID-19, obviously, or MPOX, or any sort of potential disease situation or outbreak that occurs where we may need to scale within a district, within region, or scale our state response as a whole. The first function, and there are four, within this capability is to conduct or support public health surveillance. And essentially the way that it's defined is very similar to just the straight out public health definition of public health surveillance. Collection, analysis, interpretation of health-related data, ultimately used to detect, verify, characterize, and manage an event of public health throughout that event and even following. And so within that function, there are four tasks: engage stakeholders to support public health, surveillance investigation, conduct or support routine and incident-specific surveillance, share surveillance findings, and then maintain and improve surveillance systems. So for each of these tasks, I've kind of further described what those are, and I certainly won't read all of these verbatim. But ultimately, when we think about engaging stakeholders for public health surveillance investigation, we are looking at any of the routine coordination activities, whether that's with laboratories, with hospitals, other providers, other medical partners, other stakeholders, whether that's correctional facilities, schools, et cetera, anyone that kind of has a role within in order to kind of essentially provide us, i.e. public health, surveillance data for routine or emergency sort of responses. And ultimately, the second task there, I don't know that the definition there is all like that well defined. But ultimately, we are using the data that we obtain from people that are required to report to support any sort of health-related surveillance. And so I think, to me, it does, I think we kind of have to look at what is in our toolbox, as it were, related to the data that we are able to use. And some of that does involve direct reporting. Some of it does look at electronic lab reporting and some of the increase in some of the technologies there. I think also being aware that we do have in the code and the regs the ability for the health commissioner to stand up ad hoc sort of surveillance for any sort of condition, as an example, like Delta 8. So that all kind of exists, and we kind of have to define how we're going to use the data in order to support that. And then we're going to share the surveillance findings. And I think you will see similarities to this one in some of the other functions as well, but really thinking through who are the people that really need to get the information that we find from surveillance and or our investigations in a way to, really target or work with the populations that are at risk or affected, as well as work with those individuals who are in a position to make decisions and to make them rapid or quick enough in order to have sort of an impact and mitigate the event or the response. And then lastly, maintain and improve surveillance systems. And this is something that kind of occurs ongoing, certainly within central office. And I think with all the health districts that kind of work within our surveillance systems, contributing to the way that we do maintain and improve them through essentially those evaluations, whether it's assessing, identifying strengths, weaknesses, and trying to work through improving those. And then the bi-directional information exchange, I think for this document, because it's written at a national level, is really meant to kind of look at how states share information back and forth with, say, like CDC and other federal partners. Function 2, conduct public health and epidemiologic investigations. And this is kind of the bread and butter of what we do, especially at the district level in terms of identifying the source of cases or outbreaks of disease or injury or exposures, the associated determinants within the population, report those findings to essentially anyone who kind of has a stake in the work that we do. And so when we think about conducting those investigations, our tasks in the document are conduct public health and epidemiologic investigations, provide support to local public health and provide support to local public health and epidemiologic investigations. So really speaking more to like the relationship between the state, like central office and the local health districts, and then again, share those findings from those investigations. I think a lot of this, for those that are involved in communicable disease and field epidemiology, I think this particular function and these tasks are fairly straightforward. We do and are required to follow up on reportable disease conditions as well as outbreaks, and we do that in a collaborative manner with a lot of our local stakeholders. We do work between the local health districts and central office for a number of these investigations, especially as the scope sort of increases. And lastly, the information that we do gather from the investigations, those do find their way into one or more surveillance systems. And so as we kind of report on surveillance findings, those are also in effect some of our findings from the investigation. On top of that, we do and will write up field epi reports, documentations around specific outbreak investigations, especially if they are larger in scope. And those obviously will come with either the report, an after action report, improvement plans, et cetera. And all of those can be and should be shared with the appropriate internal and external partners over the course of the investigation. Function number 3, recommend, monitor, and analyze mitigation actions. And so as we respond to emerging events or events of public health significance, oftentimes we are trying to put forward recommendations in order to mitigate the impact that event is having within our population. And so this particular function is really focused not only on making those recommendations, but then also monitoring and evaluating how effective those were, and ideally keep carrying those lessons learned forward. So those tasks are identifying public health guidance and recommendations, and then sharing the appropriate public health guidance and recommendations, and then monitoring and assessing those interventions. Identify public health guidance and recommendations. We do have DSI, along with a number of other teams within the Office of Epidemiology, maintain a disease control manual. And within there, we do have, for most of the disease conditions that we interact with or have a role with, do provide guidance and recommendations in order to go through that process, and or if we have an event that kind of falls outside the scope of a topic that we don't have in the DCM. Then we kind of work through determining what are appropriate clinical, epi, environmental related public health actions, leaning on SMEs within the agency and outside among our partners, with that focus of trying to mitigate the impact of that particular event, and making sure that this is done and the information and the guidance that we're providing is science-based, evidence-based, and kind of putting that forth. And so once that has been essentially gathered, reviewed, and essentially signed off on or approved for sharing, we then can move into that second task of sharing the appropriate information, communicating, coordinating that with any of the public health officials, any of our partners, stakeholders, in order to support again that decision making in the event in response to an emerging disease event or other event of public health significance. And then lastly, as with most of our events responses, we do want to be able to look back and work through evaluating, the mitigation actions that we took, the recommendations that we put forward during the response. How did those fare? Were there changes that needed to be made? Did it have an impact or not? And so all that kind of plays into that third task there. Function number 4, improve public health surveillance and epidemiologic investigation systems. So ultimately, I think this last one is taking a look at like the bigger picture of what we have going on from a surveillance and investigation perspective, assessing the internal, i.e. within VDH, our agency's ability to work through these processes and systems that are involved in them, and implement quality improvement measures, whether that's at the central office level, the district level, and or kind of implementing it with how we kind of interact and kind of collaborate between central office and the district. So the three tasks that we have there: evaluate effectiveness of public health surveillance and epidemiologic investigation processes and systems, identify and prioritize corrective actions, and then establish an after-action process, share after-action reports and improvement plans, and implement and monitor corrective actions. So ultimately, as we look to evaluate the effectiveness of our surveillance systems and investigation processes, that does occur. I know multiple or many of our systems that are involved in this process, whether it is feds or VOS or REDCap, we have teams that are always interested in looking at how we can improve the system itself and or set it up to be able to be of more use as we go into the next sort of event or response. Additionally, I think as we conduct our investigations and we work through the response themselves, and I'll just take COVID-19 as probably the common denominator that I think we can all kind of like reflect back on and think through. But taking something like COVID-19 and looking at how investigations were conducted over the course of that particular response, the roughly 3 years that we were kind of doing that work, and looking at the processes involved in that, and kind of identifying where we had gaps, where there could be improvements, and also where we had strengths and things that seemed to work well. And so as we go through that, that kind of naturally leads to the next one: identify and prioritize corrective actions. For many of our events, again, COVID being probably the prime example, but I think this is where we can kind of speak to activities that could happen at the local health district level, or even in different offices or teams. When something of some sort of size that generates a response, and it can be something as straightforward as a single well-defined outbreak response, and if that is something that occurs within a school or a long-term care facility and it's just within a single district, but it did require a few people to kind of work through it, it may be worth after post that particular event, and or if there are exercises that districts or central office teams are conducting. I think this applies there as well. But if after that kind of outbreak response, you are able to find time to sit down and just do, even if it's a short hot wash or an after action review, just like things that went well, things that didn't go well, I think that can help identify, and that discussion will kind of lead towards prioritizing potential things to potentially work on and or improve as it relates to all four of these functions and this capability in general that we are trying to maintain within our organization. I think naturally, as the event or response scales up, so if it's something small within a single team or district, or if it scales to be something more regional or something that is kind of led or managed at the central office level. Again, COVID would be like this very broad, all-encompassing, multiple agency type of event. Those sorts of hot washes or after-action reviews become a little bit more formalized, and there's more I think, collaboration that does and will occur with the Office of Emergency Preparedness as we look at documenting that, as well as potential improvement plans from there. But even if we don't have something that large, or if there's something that you want to do within your own scope as a team, I think there are ways to do a hot wash or like a lessons learned kind of discussion, and then kind of pull that into some sort of improvement plan or strategy going forward. And that's certainly something that I like to encourage, especially among my teams, as we look at trying to support surveillance systems for these different responses. And so the last one, establish an after-action process, share after-action reports and improvement plans. Again, I think at the national level, in terms of how this document is written, there is something to be said for FEMA and their HC process, and then there's more of a formality around this one. I think, for some of these responses at a state level, but I think conceptually the process can be applied a little bit more granularly through this, where you can have that after action process. You can talk about what sort of improvements are needed, and then kind of implement and monitor those actions and look ahead for the next event to see if that thing, if the same issues popped up or not. And once that's done, and ultimately you can determine how or who all you need to share that with internally, as well as potentially with other partners. And I believe that concludes the review of the functions within this capability. And so ultimately, to kind of wrap up, this capability 13 and the 4 functions that we covered speak to how we conduct and carry out the public health surveillance and epidemiologic investigations, and serve as sort of a lens in which to look at our planning, our documents, as well as our responses at the state level, as well as at the local health district level. I think at that point, Donald, I'll hand it back, and if there are questions, I'm certainly happy to try and address those.
Thank you, Jonathan. If anyone has any questions, feel free to either put them in the chat or you can unmute yourself and ask your question. Okay, hearing none, I think that concludes this EP&R Lunch and Learn, and we thank you for your participation this morning. If you have to have any questions that come up, following this webinar, you'll be getting an email from me that has Jonathan's presentation and his contact information as well. So you can follow up with him that way. If you've given yourself some time and you think of something that you need to ask him. And that pretty much so wraps this up. And I want to thank Jonathan for his wonderful presentation. And that concludes this webinar, and have a great day and rest of your week. Thank you.
Thank you, Donald. And thanks everyone for joining. I appreciate it.
Thank you.